is an independent China specialist. He joins us live from Hong Kong. Welcome to the programme. So I just want to ask you about this line that we have just seen from the WHO director saying that China's COVID spike is not due to the lifting of restrictions. What do you make of that?
Well, I think that it's been 3 years since China has adopted this zero COVID or dynamic zero COVID policy, which has been relatively successful in containing the number of deaths. For example, the United States has already suffered deaths of over 1 million people, and China's population is 4 times as large. But look at the death rate in China, even though China has got a much more inferior medical coverage system compared to the United States. I mean, the death rate has been extremely low. But on the other hand, China's got many vulnerable groups, particularly the elderly, and then the vaccination rate has been very, very low. And that's why China adopted a rather stringent policy to contain the spread of the disease and also avoiding putting unbearable burden to the medical system. And so far, very, very successful, but not compared with many other countries.
Okay,
but
not on the people. Sorry to interrupt, Andrew, but not.
But it's been 3 years.
Okay.
And then people's patience are very thin.
Exactly.
So that's why China is not winding down. But then there is a misunderstanding again as to what's happening. As the policy has been wound down, of course, China is relying on self-testing, sort of abolishing the need to go for the rather stringent PCR test. And then because of people are just doing self-tests, the data, the kind of record, obviously, is not complete.
Can I just jump in and ask, if I may jump in, when we see the protests of the desperation of lockdowns, I can't imagine, what people must have felt there in China. And I just wonder, why aren't they using other types of vaccine, for example? Is that a solution? BioNTech, for example, others that have worked successfully in other countries outside China?
Well, if you look at China, China has been using its own vaccines. And as I said before, the effect has been relatively successful. I mean, China's death rate is extremely low compared to the United States, for example, and compared to Japan. And both countries have much more advanced systems. So the use of the Chinese vaccine has been relatively successful. Combined with other Chinese forms of Chinese medicine, because at the end of the day, there is a wide range of different cases, and some of these cases could just be dealt with using other medicine. But what is now happening is that China is now relaxing this policy as the pandemic has been.
Andrew, I'm so sorry. We've just run out of time. I'm so very sorry, run out of time. But thank you so much for your time and your analysis, Andrew Leung.